Okay, praise be Jesus and Mary.
now and forever.
Okay, so I have actually uploaded the mm, I have actually uploaded in the Google Classroom the PowerPoint slides, no? So I do not know if the others are will be able to attend because I know that there are a lot of PLDT and smart subscribers, no? But as are there PLDT and smart subscribers in the group right now? All right. Okay, thank you, Julius. Okay, but I guess medyo di stable na. Okay, sige lang. Okay, so I think texts na lang or chat will do, no, while I will be giving you a short lecture about the topic for today. Okay, because um because we are also going to have our audit, no, so s- there are already schedules, no, for our external audit for the ISO. Okay, all right, so okay, so today uh, we are going to discuss about nutrition assessment, no, nutrition assessment. So, okay, can you see the screen? All right. So, we are now into nutrition assessment already, and so basically, I'll discuss first about the definition of terms, no, about nutritional assessment, definition of terms, so you'll have an idea of what it's all about. Okay, so this is the for this topic we have overview of nutritional assessment, purpose of nutritional assessment, forms and uses of nutritional assessment systems, what is nutrition screening, what is nutrition survey, nutrition surveillance, and then what is direct and indirect methods of nutritional assessment, and then the pathogenesis of the development of nutritional deficiency and appropriate method of detecting the condition. Okay, so nutritional assessment is the interpretation of information from dietary, laboratory, anthropometric, and clinical studies. That's from Gibson in 2005. Okay, so in order for us, nutritionists, dietitians, and other health workers like doctors, no, doctors and nurses and other healthcare health providers, no, health providers, we assess nutritional status. So especially among nutritionist dietitians or dietitians, no. So to be able to determine whether our there are nutrition concerns. Okay, so we use ABCD. Okay, so when you say ABCD, okay, so A stands for anthropometric, B, okay, B stands for biochemical, C is for clinical, and D is for dietary assessment. Okay, so nutritional assessment um, is also uh, is also uh, synonymous to is synonymous to nutritional evaluation. So before we can have our diagnosis, we need to have the data rather, in order for us to have our nutrition diagnosis. Okay. At first, probably you might find it difficult, but later on, as we go along, you will realize na, okay, ganun pala, no? Actually, in this topic is um, among the things that we need IT professionals, no, information uh, IT professionals, no, kasi for our job to be, or tasks to be easier, and it can be uh, it can be uh, we can use already a systems, no. Okay. All right. So again, nutrition assessment, nutrition evaluation, they are synonymous. Okay. So you might ask, um, ano yung anthropometry, no? Later on, we will discuss each of those, no? Which I have actually uploaded already in our Google Classroom. So, nutrition assessment or evaluation, this is the process of determining the nutritional status or status of an individual or group of individuals. By the way, nutrition assessment can be conducted either individually. So, for example, if you have a diabetic patient or client, or kayo mismo, no, it can be done individually, or it can also be done um, as a group or a group of individuals. Like, for example, in a particular community, you assess the particular community. Okay, so we conduct dietary evaluation, clinical examination, biochemical findings, radiological and laboratory tests. Okay, also, of course, clinical examination, also that includes anthropometry already. Okay, so nutrition assessment. Okay, so nutrition assessment is the first step in the nutrition care process, or what we call NCP. We will be discussing about nutrition care process later on, no? When we are through already discussing about nutrition assessment. Okay, so this is the first step, no? And then actually we have the word um, we have the um, what we call ADIME, ADIME, no? ADIME, A stands for assessment or nutrition assessment, and then the second step is a nutrition diagnosis, and then the third step is nutrition intervention. That's I for ADIME, no? And then the fourth is monitoring and evaluation. Okay, so nutrition assessment is a systematic approach to collect, record, and interpret data from patients, clients, family members, caregivers, and other individuals and groups. So, nutrition assessment is ongoing, dynamic process that involves initial collection as well as continual reassessment and analysis of patients or client status based on specified criteria. Okay, so all right, so for we're just defining here what is nutrition assessment, no? Okay, now there are four forms of nutritional assessment. We have nutrition surveys, surveillance, nutrition screening, and nutritional interventions. When you say okay, um, nutrition assessment system. Okay, so this is actually epidemiological investigation of the nutritional status of a population by various methods. This may include an evaluation of factors affecting nutritional status. Okay, so um, actually, this one is for nutrition survey. Hindi nyo makita, no? Pero if you're going to upload the PowerPoint slide, definitely you will be able to see, no, kung ano yan siya. Okay? Nutrition survey is an epidemiological investigation of nutritional status of a population by various methods. Okay, so this may include evaluation of factors affecting nutritional status. Okay, so this is useful in establishing baseline nutritional data and or ascertain the overall nutritional status of the population. So that is why we conduct nutrition survey. Okay, so for nutrition survey, uh, if you notice in barangays, no, there are health workers or nutrition workers going to your um, respective homes, no, and probably nung bata pa kayo may mga nagatimbang sa inyo, no, so yan, because you could be included in the nutrition nutrition survey. Okay, uh, and then every 5 years, the DOST, the Food and Nutrition Research Institute of the Department of Science and Technology, conducts nutrition survey. No, that's every 5 years, and from time to time may mga ano, no, um, may mga updates na ginagawa, no. So if there are changes in the nutritional status, okay? So, all right. So this actually okay. This one next is, what about nutrition surveillance? Ang nutrition surveillance naman, this is a continuous monitoring of the nutritional status of selected population. So unlike surveys, data are collected, analyzed, and utilized for an extended period of time. So for this, no, may ano na lang siya, surveillance na lang, no? In other words, there are already data. So, if the data needs an update, no, it needs to be updated, then we conduct nutrition surveillance. Okay? So, this is useful in identifying causes of malnutrition, hence can be used in formulating and initiating intervention measures. Okay. Okay. This involves nutrition assessment involves comparing an individual measurements with predetermined risk levels of cut-off points. Okay? So meron tayong tinatawag na mga cut-off points, no? If you notice in the Google Classroom, I have asked you to download um, a material, merong comment doon sa nutrition anthropometry na uh, you will na meron siyang link doon na merong mga tables, no, na meron siyang mga cut-off points, no, na ginagamit namin. Okay? Ginagamit namin, no, for to determine as to determine uh, to determine the whether there is a whether one is obese, the child is obese, whether the individual is underweight, overweight, or normal. Okay, so um, we also conduct OPT, no? By the way, OPT is stands for Operation Timbang. Okay? So, okay. Another is ito, the types of um, nutrition, 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 ito, nutrition interventions, ang nutrition interventions, okay, ang that is actually for nutrition screening, no? Uh, nutrition screening. And then this one, nutrition screening is actually isi-screen namin ang mga pasyente kasi in as much as we want to accommodate everybody, it will be difficult for us not to get a 100% um na ano I what I mean is that there are priority individuals or there are priority clients. So that is why we conduct nutrition screening. Okay? So isi-screen lahat, no? And then if example, merong based on the assessment is okay, underweight pala ito or there is risk of um, malnutrition. So tututukan namin 'yon. Okay? So with definitely with certain problems there, if we identify certain problems already, then we are going to have the interventions na. Okay? So interventions could be in a form of supplementation, fortification, or dietary approaches. Okay? But don't worry, as we go along, medyo maintindihan nyo ito, no? Okay. All right. So the the four methods used to assess nutritional assessment are again anthropometric, biochemical, clinical, and dietary. So this one is more is a simpler way of presenting to you, no, para maintindihan nyo ang nutrition assessment. Okay? But as we go along, medyo maintindihan ano yung anthropometry, ano yung biochemical, ano yung clinical, and dietary assessment. Meron pa yung E, no? E is ecological. Okay? All right. Now, when we say, okay, by the way, we have direct methods and indirect methods. Okay? When you say direct methods, these are clinical, biochemical, anthropometry, and biophysical. So in other words, these are these directly affect nutritional status. So direct talaga, no? Whereas ang indirect method, we have food consumption or dietary survey, dietary assessment rather, vital statistics, ecological, and sociocultural factors. Indirect methods is a parang supplement lang siya, no, to the direct method. So the food consumption survey or the dietary assessment uh, cannot be complete without the direct methods. So in the same way, direct methods um, can also be more and it will be more enriched, or it can be more um, parang we would know kung the causes, no, like bakit underweight ito, well, because we use the dietary assessment. Okay? Pero bakit indirect method ang dietary assessment? Kasi it doesn't mean na pag for example, we less down the food ito tapos kunyari konti ang intake mo nito, or there are some people na um, malaki ang intake nila nito, no, ng particular nutrients or particular food item. It doesn't right away mean na it doesn't right away mean na malnourished na agad ang individual. Okay, kaya indirect method siya. Okay? So vital statistics also is an indirect method, ecological and socio-cultural factors. Okay? So all right. So for example, okay, there's stages of nutritional deficiency, no? So first is at tapos you would know kung anong ginagamit namin or na ginagamit namin or natin na assessment method. Okay? So, for example, kung stage 1 ng nutritional deficiency, so first is dietary inadequacy. So, dietary inadequacy, the method used for that is dietary assessment. So, for example, in the case of vitamin A intake, no, deficient vitamin A and intake, no, will yung for example, based on the hindi pala umiinom na hindi pala kumakain ng uh, yellow or yung mataas ang beta carotene, no, tapos hindi yung intake niya, no, meron kaming assessment niya, no, there are a lot of computations, no, to determine. So deficient pala ang vitamin A intake. So what we use is dietary assessment. Okay? So the second stage is biochemical. Okay? So decreased level in reserved tissue store. The method used is biochemical. So biochemical, ito na yung mga sa blood, sa ihi, no? Where else? Uh, feces, no? Yung sa laboratory na ginagawa natin. Okay? So, sa laboratory na ginagawa, that is actually biochemical. So, example dito is there's reduced vitamin A liver stores. So, we can only determine itong na vitamin A stores are reduced through biochemical assessment. Okay? And then what follows is decreased level in body fluids. Okay? So biochemical pa rin ang method that is used. Though, so example is there is reduced levels of vitamin A. And then eventually, the stage 4 is there is decreased in functional level in tissues. So what we use is both anthropometric, either or both anthropometric or biochemical. So, for example, in the case of vitamin A, there is decreased vitamin A available to cells within the eye. Okay? So, um, stage 5 is decreased activity in nutrient-dependent enzymes. So, what we use is biochemical. Okay? So, eventually, merong functional change, and then seventh is ang assessment namin diyan is behavioral and physiological. So yan meron ng impaired ability to see in dim light. Okay? So not only that there is decreased vitamin A available cells within the eye, meron ng impairment ability to see in dim light. Okay? So kaya behavioral or physiological na ang ginagamit namin na assessment method. Okay? So for stage 7 is clinical symptoms, no? Clinical, makikita na namin, no, physically, no, grabe na, mas lala na talaga kasi stage 7 na siya. So the outer covering of the eyes dries out, thickens, and it is susceptible to infection already. And lastly, 8 is anatomical signs. So makikita na natin na for example, in the case of iron deficiency anemia, makikita na natin na napaka-pale na ng pasyente. Okay? So kunyari dito sa eyes, no? Itong sa eyes, tingnan namin yung eyes kung luspad ba kaayo, no? Yung palm of the hand, yung palm, if it is very uh, it's uh, it's very uh, ang tawag nito the parang may loose pad, no? Ano bang English niyan? It's very pale, no? Kung
Mm.
merong pale, okay, so yan, clinical symptoms or anatomical signs yan siya. Okay, so in this case, dito sa vitamin A, the vision is lost already. Okay? So, I'd like you to read that PowerPoint, no? Download that PowerPoint so that you will be able to understand better what is nutrition assessment. Okay. Now, we will proceed to nutrition anthropometry. Okay. So, ito, what is nutrition anthropometry, no? Okay. Okay, this is the first among the A, B, C, D, and E. No? Diba? If you remember, na-remember ninyo sa nutrition assessment, may A, B, C, D, and E. No? So, ang first is anthropometry. Okay, are you still there? Can you see the screen?
Yes, sir.
All right. So, nutritional anthropometry. Okay, anthropometry. Okay, we have weight measurements, linear measurements, soft tissue measurements. Okay, anthropometry uh, is the measurement of variations of the physical dimensions and gross composition of the human body at different age levels and degrees of nutrition. So this is a measurement of body size, weight, and proportions. Okay, so this is obtained. Measures obtained can be sensitive indicators of health, development and growth in infants and children. So this can evaluate nutrition status. NS is nutrition status, whether obese or emaciated, meaning parang butot balat na. No? Emaciation is butot balat na. And then valuable nutrition anthropometry um, is valuable in monitoring the effects of nutritional intervention for disease, trauma, surgery, and malnutrition. Okay? So, for the weight, no? Okay. So, for the weight, we have a common anthropometric measurements. We have the weight, the height, or stature. Okay? Height or stature. Kung, for example, above 2 years old tapos makatindig, no? Makastand, uh, the makastand, so we use the height. Okay? Pag, for example, below 2 years old, pwede siya below 2 years old, pwede din siya above 2 years old for as long as ang pag-measure mo is nakahiga siya, length yan siya. Okay? So, we also have body circumference. Body circumference, like let's say for example, circumference of your waist, no? Waistline, no? Yan, body circumference, no? Ginagamit namin yan, or itong mid-upper arm circumference, no? But don't worry, mapapractice tayo niyan later on, no? And then we also have birth weight as is one of the common anthropometric measurements. Okay? So we have the other anthropometric measurements. We have percent of desirable body weight, we have BMI, we have other anthropometric measurements. We have ito, skin fold measurements, waist to hip ratio, and then the direct methods of measuring body composition. Ito mga high-tech na ito, no? I will show you I'll show you some videos, or I will show you in actual, no, na itong ano yung bioelectric impedance, no? The rest are difficult to we do not have those um, unfortunately we do not have those um, in school, no, kasi napaka expensive ng mga equipment na yan, no. So but bioelectric impedance class, we can do that, no. Okay, now for weight. All right, so for weight, we use weighing scale, okay? Weighing scales such as beam balance scales or clinical scales would be ideal, but a bar scale can be used in their absence. Uh, no, wait. So the subject or the person you are trying to measure, no, should wear a light clothing. So with no heavy objects in pocket, and weight data is recorded when the pointer stops to move. Okay. Have you tried, question, have you tried na may nagtimbang sa inyo?
Yes, sir.
Okay. All right. So, ideally, no, dapat, thank you. Ideally, dapat walang, very light lang ang clothing. Okay? Kasi the clothing will uh, add add to your weight. Okay? So, chine-check din namin yan, class, no? Whether merong mga coins or mga keys or cellphones, no? Cellphone na nasa pocket, no? Dapat wala talaga, no? Dapat wala para we get to be very objective. We get to have a objective data. Okay? So, then, the weight data is again recorded when the pointer stops to move. Okay? All right. So there are advantages or disadvantages, no, of weight. Advantages is it's simple, it's commonly in use, and weight can be determined fairly accurately by personnel with minimum training. So hindi kailangan ng ano na talagang ite-train na grabe ang training, no? Kasi minimum training lang, you would know already, no? Ang disadvantage lang is that it depends on accurate age determination, which is sometimes difficult, and interpretation and individual basis may be complicated by edema or kanang pagmanas, no? Manas or edema or manas or what is that in Bisaya? Uh, kanang manghupong, no? So, yan, we don't get the the right assessment kung merong if there is edema or dehydrated ang pasyente natin. Okay? So, okay, you cannot see the beam balance, no, pero ang beam balance is okay, yung ginagamit namin as kanang sa clinic gani na kuan, clinic nga beam balance, sige lang wala, hindi makita sa picture dito, no, pero yung but if you are going to download this, may picture yan siya, no, dapat, no. Beam balance ang ginagamit namin. Tapos for children, we also have what we call the Salter scale, no, kana ganing ibitay ang bata. Nakakita na ba mo, ana?
Yes, sir.
Oo. We use a Salter scale, no. Ibitay siya, ibutang sa kunyari duyan or kanang shorts, tapos ibutang dito sa ano, sa duyan, no. Kesa sa bathroom scale, no. There's a difference between beam balance at saka yung bathroom scale. Usually I think what you have at home is bathroom scale. Yan siya kanang mutungtong lang gani ka na then naadayon mo ko ano burag naadayon then you can already read your kuan. That's actually a bathroom scale, no? You can right away read your measure your weight, no? Pero ang beam balance is katong nai-adjust gani nga okay kani siya kanang nana siya sa tunga, nana siya sa point, no? So that's actually beam balance. Then we use we also use um Salter scale, no? I'm going to send to you ano yung mga examples niyan in our ano no kasi hindi niyo siya makita, no? In the in in our messenger, no, kung ano ang mga itsura nito, no? For the height, stature, and length, okay, so we use this assess linear dimensions composed of following the legs, pelvis, spine, and the skull. This is less sensitive and generally an indicator of past nutritional status. This determines stunting or dwarfism. Okay, so yan. Again, as I have told you, kung for example, anong difference ng length at saka stature. Okay? Pag length is also as recumbent length, if naka-lie down ang subject. Okay? So usually, children less than 24 months of age or for children between 24 to 36 months of age who cannot stand erectly without assistance. So length ang tawag natin dyan. Stature, this is the standing height. So for 2 to 3 years old and older who are cooperative and able to stand without assistance. Okay? Hindi niyo makita ang Frankfurt horizontal plane. Na ang Frankfurt horizontal plane is yung ulo is actually dapat wala siya nakadungo, wala po siya nakahangad. Okay? So, yan ang Frankfurt horizontal plane. No? Makita niyo yan once you get to upload download this video. No, I do not know I do not know kung why I don't get to see kung the photo, no. Sige lang, you will see that, no, pag i-upload ninyo yung PowerPoint. Okay? Ma-upload man ninyo, no? Ma-download rather. Yung nasa Google Classroom. Okay. So okay. So for height or height, stature, length, advantages, this is an inexpensive tool. Tools may be used, simple to do this in the field, and less sensitive than weight to changes in growth rate. Errors in measurements are easily made, and other factors play a role as determinant of height, like for example, genetics. Okay, we have body. We also have body circumference, no? Yung MUAC, no? We use the MUAC tape, no? Mid upper arm circumference, no? Kung itong dito sa arm banda, no? Sige lang, pag I am going to perform to you basically kung paano ito ginagawa. Okay? So, body circumference, no? All right. Okay. Ang birth weight naman, sa birth weight, this assess nutritional status of neonate or newborn, to mga bagong panganak. This is related to maternal nutrition and socioeconomic status, usually taken as cut-off point for low birth weight babies is 2,500 grams. So, pagtimbang, for example, sa bata is, kung for example, especially pag below 2,500 grams, kasi normally 3 kilos or 3,000 grams, no? Pag 2,500 na gani, that's the cut off already, or lower than that, 2,500 grams, meaning low birth weight yung bata. Okay? So, the advantage of this is same as the weight for age, and the birth often disadvantage is birth often unattended by personnel. Other factors play a role like gestational age, infectious or toxemic episodes during pregnancy. Okay, so ang reference standards, yun na, ipaano ko sa inyo, no? Ang gagamitin natin ng mga na reference standards um, are the uh, yung uh, yung yung nasa National Nutrition Council, which I ask you to download in the Google Classroom. Okay? So, may mga reference standards or reference tables tayo. Okay? So, okay. Sige lang para mas ano. I think I think it's best na um kuan it's best that I'm going to show you, no? Show you this, no? Kesa sa uh, mag-imagine mo, no? Okay. For example, okay, itong sa nasa Google. Classroom siya, class. Okay? Okay, are you still there?
Yes, sir.
Hello? Are you still there? Alright, wait lang ha. Okay. Can you see this? Can you see the screen? See the screen? Huh? What do you see sa screen now? Okay, can you tell me kung anong Alright. Yan. WHO or World Health Organizations, no, or child, ang CGS stands for Child Growth Standards. So what I want you to do is to download all these, download all these para mas ano ninyo, mas ma intindihan ninyo, kasi it's difficult na kuan it's difficult na ano, dapat kipicturean ko na lang, i-download ko daan da. Ang hina Okay, can you see me? Can you hear me now? Hello? Okay na? Alright, sige, sige. Okay. Uh, I'm going to I'm going to show you a ano ha kasi I do not want to bore you with texts, no? Gusto ko action agad, no? Kasi we have limited time already. Okay? Uh, have we have limited time lang. Okay. So I'll show you. Okay, this one. All right. Yung sa the one that which I told you na i-download ninyo is ito yon, isa sa mga kuan, yung wait for wait for age, no? Nakita ninyo? What do you see? What do you see, class? Hello? Hello? Makita ni Okay. All right, very good. Okay. So this one is a child growth standard na for weight for age for girls 0 to 71 months. Okay? So ito dito, ito 0, no? Like let's say for example, wala pang 1 month. Okay? So age 2, uh, age age in months, no? Um, all right, 0 pa, for example. So, for example, kung ang weight ng bata is, for example, na babae ha, na babae is from 2.4 to 4.2, meaning that is still considered as normal. Okay? Nakuha? Normal ang nutritional status. Nakuha? Okay. Pag 4.3 gani class, kilograms ha, kilograms yan siya. I'm talking about kilograms. Kung 4.3 na yan siya, tapos 0 kuan yan siya. Nasa plus 2 or more than plus 2 standard deviation na siya. Okay? So, if you can see, kung underweight, kung nasa negative 3 standard deviation or SD, from 2.1, kunyari, ang pag-determine ninyo is 2.1, underweight is from 2.1 kilograms to 2.3. Pag sinabing severely underweight is 2. Okay? So, for example, let us have, may mga pamangkin ba? Hello? Hello? Can you hear me?
Yes, sir.
Okay. But, alright. Sige ha. Alright, very good. Okay. So, for example ha, sa mga table, can you see the screen? Can you see the screen?
Yes, sir.
All right. Okay. For example lang ha, kaya may yellow yan siya dyan kasi 0, tapos ito, ang 12 is actually 1 year old, no? Kasi 12 months yan siya. Tapos 24 months is 2 years old. Tapos I think third na mo'y guide, no? So say for example, nag-measure og bata, no? Tapos na babae, no? And then ang bata nga babae is you have identified na ang bata na babae is ang age ng bata na babae is na infant, no? Na below 2 years old is say uh, 27 months. Okay? So, kunyari, 27 months. So, punta ka ngayon, tingnan mo doon sa 27 months. Okay? 27. So, nandiyan ang 27. So, say for example, ang pag, pag-weigh gani, pag-weigh sa bata is, say for example, 9 kilos lang siya. Okay? 9 kilos lang ang bata na babae. Okay? So what will be the nutritional status then kung 9 kilos lang? Na 27 months. Hello? Ang question ko, kunyari merong 27 months na bata, na babae, tapos 9 kilos lang siya. Okay? Now, my question is, what is the what is the nutritional status sa weight for age? Hello? Can you hear me?
Yes, sir.
Okay. Okay, all right. Thank you. All right. So, okay ha, for example, ha, um, okay, wait for age muna tayo, no? So, wait for age. For example, ang example that I have given you is, kunyari, 27 months na batang babae. Okay, tapos 9 kilos lang siya. So,
Mag-out na lang daw sa Google Classroom para dili sayang ang grade pa.